All right, outstanding. Thank you everybody for joining us today. It is not going to be our typical Zoom meeting at Choice and Aging where we see everybody in all the squares. This is set up as a webinar style education session. So what's going to happen is Heather's going to walk us through some slides and talk to us about the vaccine rollout specifically for the older adult population. And after she's done going through her slides and making us all experts on the vaccine rollout, she'll open it up to questions. And I want you to feel totally comfortable to chat, to write in the chat whatever your questions are. If you are not comfortable with doing that, you are welcome to either email Sarah or me your questions or comments, and we'll ask them out loud. So nobody needs to feel uncomfortable, and everybody should be able to have their questions answered. So I am super excited to present to you Heather. And I was not, I asked for Dr. Levin. I have this strange love thing going with Dr. Levin. And when the county said, oh, we have this nurse educator, she's a nurse practitioner, she's blah, blah, blah. And I love nurse practitioners, by the way, I should say that too. But I was like, really, it's not Dr. Levin. I don't know if we can do this. And Chelsea had a conversation with Heather and said, Debbie, you're going to love her. And I was like, yeah, right. I want Dr. Levin. And then on Monday night at our Government Affairs Committee meeting, who was the presenter but Heather? And she is really fantastic. And you will see that if I shut my mouth. So without further ado, take it away, Heather.
All right. Hello. Thank you very much. I'll have to say that I love Dr. Levin as well.
Oh, good. So you understand.
Oh, totally. So thank you all. Thanks for having me, and thanks for letting me impose, because I am a nurse practitioner. I've worked with Contra Costa County for more than 20 years. I was an ICU nurse before that at the old Mount Diablo Hospital. And so my core and my roots are patient education, community education, getting us all along so that we know what we need to know about what we're facing in front of us, healthcare crisis, health conditions, and how to access care. And that I am a provider as well. Before we had COVID, I was a provider for our healthcare for the homeless population, working in shelters, doing outreach, and I've done lots of things through the community. But since we started COVID, with Dr. Levin, she and I were sitting on the phone banks in the beginning when we needed to see who could have tests, because there was a scarcity, and like, yes, these need tests. And then we were doing the contact tracing. Then we were working in nursing homes, making sure that when there were outbreaks, there was support. And now I've worked with schools to make sure we got the education out there. And now I'm working with the team to make sure that everybody is excited and understands about the vaccine, but understands what we're able to do with scarcity in the beginning of the vaccine supply. So we want you to know what you need to know. So thank you for having me. So there we go. Now I'm going to start up our presentation. Here we go. We will talk about what the numbers look like in Contra Costa County today, give you a little bit of idea of the scenery. I'm going to talk about vaccines. I'm going to talk about how we decide how many, who gets them in what rollout phase. We'll talk about how it works, the vaccine, about the logistics, right? It's easier to understand what's going on if you understand all of the Santa's elves in the workshop getting vaccines out to you, because that's a little bit, there's a huge infrastructure behind mobilizing this effort that we weren't doing a year ago. We had no idea this is what we would be doing. Maybe 13 months ago, we had no idea. So lots has gone on to this. And then how you can stay informed and know when you or your loved ones would be eligible and how to get the information. So to start, Contra Costa County, this is on our website, the cchealth.org, and gives you an idea. And this tells us how we're doing in the state, and it tells us how we're doing in the county. And these numbers here might not mean a lot to you, but these metrics are what we look at and our health officers look at to decide, are we okay to open up, right? You might hear about tiers, or you might hear that the restaurants aren't open, and the way the county decides should restaurants be opened or closed, should you be able to go get a haircut? All of those things is by looking at these numbers. This 44 per 100,000, this 9%. These are the numbers they look at. We want this 44 number, 44 cases per 100,000 residents. We want it to be 25. We really want it to be 0, but this is what they look at to help them decide, do we want, how open can we be? How much disease is in the population? So these are numbers. You don't need to know them, but understand there's a formula that county officials, state officials, federal officials have to decide, is it safe to go out in the community? This is a little bit about the numbers that in the world, and this is what we're doing in Contra Costa County. There's about 1.1 million residents in Contra Costa County. In our public health department, we enfold and want to take care of the 100,000 or 1 million, excuse me, residents. And so far we've done about 1 million tests. Some people have had multiple tests. There's about 55,000 of our 1,100,000 residents that have tested positive. Of our residents, it's not only if it's you or your family member, 489 have died from COVID in Contra Costa County. To date, the number of vaccines that have been given to the county to dispense and vaccinate people is about 101,000 doses. And that is for first dose and second dose so far. And we've administered almost 90,000 doses. And so that's not quite 90,000 people because it's a 2-dose regimen. So that's what we've been doing in our county. And you can see worldwide, which I think is very exciting, 68 million doses have been given worldwide. And that means for some of the people that might be hesitant, there's been people before you and 68 million people who have had vaccines. So we want you to feel like, okay, this isn't so new anymore. 68 million people in the world have gotten vaccines. I've gotten a vaccine. I hope everybody else who has access to vaccines will want one too. This is my visual. I want you to imprint on this. This is the number of vaccines. See these stair steps? Vaccines. This is the number of vaccines that we've administered since yesterday. Today's the 27th, yesterday's the 26th. And so that's 93,000 amazing doses that have been administered. And again, that's not 93,000 people because a lot of people have had 2 doses, but not everybody's had 2 doses. And so that's the number of vaccines are going up. And see here, COVID cases, we had our surge and you see the number of COVID cases is stair-stepping down. And so this is good. So in the combination of practices, good practices, vaccines, mask wearing still, hopefully the vaccinations will go up and COVID cases will keep stair-stepping down. I like that. So let that burn in, that image stay with you. Okay, what we know about COVID-19. Some people will get very sick from it. 489 people in Contra Costa County have died. Some people will not get sick at all. So and we just don't know. We don't know who will get it and how. We had one nursing home that so many people got it in the nursing home and few, if any, died at all. They were just up and around and helping. We think that's the most vulnerable. And we've had other young people that got it that we didn't expect that have passed away. So we don't know. So we don't know. It can be, we know that it affects people 65 and older the most, and more than 85% of the deaths in Contra Costa County have been people over the age of 60. And so they're our most vulnerable population, and we want to protect them the most. And the most effective way we know to prevent infection has been through masking, right? The mask is really important. Distancing is the most. That's why we've said stay at home, right? Shelter in place, that stay at home order, hand washing, and now we have the vaccine. Those are the most important things we have been doing and are now doing and can do. And I think we need to have it in our minds. This is what we're doing in 2021 at least. The science for the vaccines. So it's when we say mRNA, I don't know if you say it, but every vaccine needs to get into the body on a little vehicle. Something needs to carry it into the body. And this is what is carrying in this current vaccine that we have. It's called mRNA, and it's just a messenger, right? It gets the vaccine, kind of rides the little spike protein COVID on its back into your body through the vaccine, right, when you get the injection. And then the mRNA, or the vehicle that it came in, disappears. It doesn't stay in your body, it doesn't change anything in your body. It's just that little delivery vehicle that gets the deactivated dead virus into your body, so that your body can then say, oh, this is something new I didn't know about. I need to build antibodies. I need to build up a defense about this. And so that's what vaccines do. And that's what this vaccine does. The most common side effects for the people, the day, and the things to expect, the day of vaccination, expect that you're going to wait for 15 minutes, because if you might have an allergic reaction, we think it's going to happen within those 15 minutes. And they're very rare. Remember, 64 million vaccines worldwide. It's very rare to have a vaccine, but you get the people at the vaccination agencies and the MaxVac sites and the doctor's offices. They'll always watch you for at least 15 minutes. And that's just good practice with a vaccine. The day of or after the vaccine, some people have a pain at the injection site. I had a sore arm. You might be tired for a few days. Yeah. Some people have reported headaches, fever, or feeling feverish, chills. Good news, you can see I'm gray-haired. Some of the older people that have been getting it, they don't have quite as many symptoms, and that's the good news, right? Your immune system is responsive, but it doesn't overreact to things. It's chill and it takes it in. So you might have all of these, or you might have none of them. It's still working. Don't worry. You don't need to have all of these to have a good immune response. Maybe the second dose, you might have a little more sore arm, and I did. You might have the headache, the fever, the chills. They only last a few days if you have it. Do not, and this is a question, we don't want you taking Tylenol or ibuprofen before you go get your vaccine, because sometimes we think that makes your body not as alert and ready to respond. So we don't want to blunt that response. So when you go home, if you've got pain, go ahead and take the Tylenol, the ibuprofen, something afterwards, but don't take it before you go in. That's just good practice. It's good practice. All right. Everybody wants to know when they'll get it and how we're making these decisions. Well, there is it's an ethical and equitable allocations committee. That means there's a group of people that are saying, okay, we've only got 15,000 doses per week. And that started at 5,000, 6,000. We only have a few doses per week. How do we decide who gets it? And so this is a bunch of good human beings trying to think of all 1 million residents and trying to do the best they can for the most people, really thinking about the greater good. And so this is—
Thank you for saying that. I'm on that committee.
Oh, are you? Okay.
She just called me a good human being, everybody,
You
just so you
are.
know.
It's
But she
hard
didn't know.
work. Yeah.
You know what? It's really, it's painful. It's painfully hard. Yeah.
And yeah, good. So I'm so glad that you're on this, because it's just really trying to do the right thing for the most people and everybody. Like, I think Debbie might prioritize and say, my people should get it first, but there's other people, right? And you're not, and she's not wrong, right? But everybody's right for different reasons. And so how do you do it? And so it goes back to that number that we say, who's going to get the sickest and who's most likely to die? And that's how the federal government, the state government, and Contra Costa County has decided these are the people that we are going to take care of first. But there have been some like outlying conditions where they had to say, wait a minute, we have an emergency here. We need to take care of this group of people too. There was an outbreak of COVID in the detention center. And so I understand this was a hard decision, but what you want is these were people that also had health conditions. And if we had a lot of COVID there, it might have filled up our hospitals, our ICUs, and then we wouldn't have had access for other people who really needed that. So that, I know that was a hard decision, but we felt it was they felt it was the right decision, and we have to respect that. We never know what we would do if we were in this situation making these decisions. Again, good human beings doing the best they can with the information and the scarcity and the low numbers of vaccine to give around. So that's that's how decisions are made. Right now, we are nursing homes. We're going to touch all of them and give the first dose. We think by the end of this week, we think that all large nursing homes are going to have their doses. We think most of the smaller assisted livings are also going to have their first doses. And so we're excited about that. The goal is here for the county, 1 million doses by July 4th, just as a, you know, we're starting with the doses that we have. And so I don't want to say we're going slow. We're going as fast as we can with the supply that we have, and everybody is going to have access to it. And hopefully at least 500,000, half of our residents in Contra Costa County will be vaccinated by July 4th. That's a reasonable goal. And the goal to, so I'll go back. I'm going to talk about this. The goal to make it easier. We want everybody to be able to get the doses. And the big goal is to make it easier to access. And right now it's difficult because the vaccines that we have are fragile. They need super deep freeze. The vials can only be open for a few hours or a day. And so they're fragile. And so that's why we have these dedicated sites and places that give out the vaccine. So it's not something that we could put in our pocket and go house to house and give the vaccine. So that's what's making it difficult in this moment. So we want to be able to have access to the vaccines in a way that's equitable and get to people. So going into these nursing homes has been a huge lift. It has had to be really well coordinated. So we're trying to think of how we get it to people that are homebound, and what's the easiest way to do that. So again, good human beings trying to figure out the best way to get it to the most people. And when we talk about getting it to the most people in the most places, these are the hot spots. You see these red spots. And so we're putting up what we call max vac sites and trying to have providers in these areas that have the greatest risk. So it's far West County, East County, Central County, trying to make sure that we have vaccination sites spread out around the county and in pharmacies, Safeway, Rite Aid, Walgreens, not yet, CVS, but we will have vaccines in partnerships to be able to get these out to people. But this is what the county and once again, people trying to use good information to figure out how we spread out and get that vaccine out to as many people as we can in the most convenient manner and efficient, not convenient, but efficient. Partnerships, again, we discussed this. Again, here's Debbie's group, the ethical and equitable. First thing has to happen is we decide who gets it. Who should get it in what priority according to what the state has said. Then we've got these partnerships that help us get it out to people. Lifelong, La Clinica, Kaiser, Sutter, John Muir Health, Contra Costa Health Services, and now Optum. Did I put it on here? Yep. Now Optum is a state site that's also partnering and getting vaccines through the allocation, through the supply that the county has had. And so these are our partners in getting it out. They're the vaccinators for us. And then we have some sites for what we call max vac sites. You might have heard that down at Disneyland, they're opening up these centers where they've got people coming in. So we're trying to prop up these sites that are county run, but we also think it's very important to leverage the community partnerships. Eventually, we hope to have it with as many partnerships in the community, but for now, it's these partners, Lifelong, La Clinica, Kaiser Sutter, John Muir Health, and these 4 vaccination sites. Right now, we're giving, this is 5,800 doses per day are being given, and the goal is to get out 9,000 doses a day of vaccine, but that's going to depend on the supply that we have. And we look at this and we try to spread it out. We're getting about 15,000 doses. And if you look at that, receiving about 15,000 doses, we're giving about 5,800. This is also Kaiser, Sutter, John Muir are getting an extra supply that we are not an extra supply. They're getting their own supply that's not allocated through the county. And so we think this is accurate. So between what the county gets, these 15,000, plus what Kaiser and Sutter is receiving, that's what's getting us to 5,800 doses a day. It's a little math, but it's the equity. That's how we're trying to share, divide and vaccinate. Not divide and conquer, but divide and vaccinate the process. Now here, we want everybody informed because everybody here, we want to be ambassadors of good information. We want you to know how to get good information. Again, we want to show you these partnerships, the people that we work with. If you go to the coronavirus.cchealth.org, you're going to land on a page. And here, I'm going to go back and forth. So this is our website. And so I would love everybody here to know how to get to this website and navigate, because this is where you'll stay up to date. Because the information that I had on Monday, today is Wednesday, is different. So yesterday I had thought that we were only going to be doing age as part of our equity and our allocation, but I see that the state put out some information that there is going to be some flexibility according to supply about prioritizing not just by age, a little flexibility. And so we get the dates from updates from CDPH. It was different than what we thought it was going to be on Friday. And so here is where we find out these, you'll be able to come and find out. So you can look at click on vaccine, you can click on resources, you can go to the home page here, that'll give you updates. And here they talk about it. We've immunized about 11,000 of an estimated 77,000 people over the age of 75. We want to get all through that 77,000. And so that's how the county and the state has asked us to prioritize. And so once we feel like we've done a good job getting there, then we'll plop down into and include the 65 and older. And then if we can do that and feel like we're doing a good job, we might flex in and pull in some of these other prioritized groups. So this is a good place to get good information. I'll go here to the vaccine webpage to make vaccine appointments. You can click on here and it's going to give you some information. This will tell you how John Muir Health is prioritizing, if you've got John Muir, if you've got Kaiser, La Clinica. So this is a place I want everybody to know how to get to. I'll see, what does it say here? Oh, it clicks us here. That's okay. Kaiser clicks you there, but I'll show you how to get to these other links, because here you can click on this website, and if you're a Kaiser member, it will click you in and it'll take you to, let's see if it does it. Takes you to the Kaiser landing page. So this is a good place for you to be able to go to. It's a one-stop shop to get you, navigate you to places you need to go. Now I'm going to go back and see if I can get this going again, and we'll go back to presentation. Yep. And we can go back to this page. Up, present. There you go. Don't mind. Oh no, look at me. We're going to flick back through. What a tell, right? Okay, so if you go through, go through your health home, we think that's the best place. We want you to, because if you're a John Muir Health, they're getting allocation, they're getting supply from the county for their members, we think, in portioned out, right? They're not getting 100% of the doses for their people, but go ahead and reach out to them first, Kaiser, because they've got the doses there. If you're not with one of those health systems, if you're undocumented, if you have a family member that's 75, 85, 90 years old and undocumented or doesn't have insurance, please come to this website, come to our website. And this is the link here. Oh, I'm not going to do it. But this is what you're going to see if you click on the link in our website, and it's going to be a vaccine appointment request form. Just again, to repeat, the demand is far greater than the supply. We're still prioritizing by age. Caregivers are in a priority group. So if you're taking care of somebody that's at home and can't get out and get to one of the vaccine sites, we want you vaccinated. And so even if you're not 65 or 75, if you're a caregiver, you're going to protect yourself and you're going to protect your loved one at home, the person you're taking care of. Please consider getting it. 65 million have been vaccinated already in the world. We think it's safe. We think it's smart. We think it's going to move us forward and get us past COVID. When you do this vaccination request form, expect to get an email back saying we received your request. Do not, here's some more dear humans that are, they're manning phone lines. So it's not just those allocations and Debbie's people. It's these wonderful people that are on the phone. Imagine 10,000 people trying to get an appointment and call, and they want those dear 15,000, and not everybody's in the priority group. So human beings are answering phones, and they're looking at these request sites, and they're trying to make sure that it's fair and it's just, and it's looking at the greater good. So these are some questions that were given. Age is 75 and up in the general population. to date, there are no drop-in appointments. It's always going to be with an appointment. Right now, pre-existing conditions right now are not prioritized. So you might make a submission to John Muir Health and say, but I've got this. So right now we're really going by age and priority in healthcare workers and caregivers like yourselves, some of you, so that we want you taking care of it, because again, the older you are, the more vulnerable you are, more likely you are to have severe outcomes or death. So we're taking care of those most vulnerable. Vaccines are free for all, no insurance is required. Again, the call center is busy, be kind to those humans. And like myself, I worked in healthcare for the homeless, I was a provider, but I'm now doing things with COVID that I wasn't doing before. So we're all trying to do our best. And so not everybody is a person that answers the phone or does tech assistance. So we're really trying, and I'm so proud of the effort and the mobilization of what people have done in response to this. We think it's the best idea, again, to sign up with your healthcare provider first, know where, make sure your information is up to date. If they've got your right email address, they've got your right phone number so that they can send you text alerts or emails to get you scheduled. There was a question about, I heard that one of the vaccines was bad and they threw it out. There's been no bad batches. We don't have that. There was one group, a lot number of Moderna vaccine that they said there was, in one day, there was what they thought were allergic reactions. And they said, okay, wait a minute, this Moderna, let's hold off and make sure everything's okay. And so they told all of the counties to stop giving this one batch. They did an investigation and they said, no, it was fine. So it wasn't, there was nothing wrong with this. These allergic reactions were not were not from bad batch, wasn't anything like that. It just happened to be more coincidental than anything else. They said, go ahead and continue giving these doses. Our county had 3,300 doses of this. We had absolutely no problem with this at all. I don't know exactly what it was. I would say it was probably data input, but don't quote me on that. I shouldn't have said that in the first place, but certainly these batches were good. And also it tells us what real-time response there is to information. So it's not things that we're finding out a week, 2 weeks, oh yeah, there was something with that a few weeks ago. This was the same day. They said, hold on a second, something's up. And so they stopped the vaccinations with this lot the same day after. And so there's real immediate responses to this. And I love that. That's because the CDC has this website that everybody's able to put the information in. And so they're looking at this every day because they want this to be, and it is, the biggest public health response to anything in the history of the world, right? So we're doing something big. They're doing this responsibly. And so that's very important. So know that there's real good in real-time information going out. 9 o'clock. Thanks, guys. So here is when I talk about these web portals. If you're Lifelong, if you're La Clinica, if you're Contra Costa Health Services, go on and make sure that your MyChart, you're signed up for MyChart, and that your information is correct. They'll sign you, make sure they can send you little push alerts. Like if you become a priority group, they'll reach out to you and say, hey, it's time for your 75. It's time for you. When you're 65, you should get either a phone call or a push alert. So make sure your information is up to date. And your text, right? They might send you text. So don't spam it. Don't ignore some of these messages, but from your healthcare provider. Do not receive and schedule yourself for a not trusted partner. And you can go to our website and see what our trusted partners are. Okay, so that's really important. There's other John Muir. If you're John Muir, if you're Kaiser, if you're Sutter, each of them are giving their own vaccines, and they each have information about how they're responding. So you go to their website and get information about how they're scheduling and prioritizing their population. And not to be, I want you to say, we've got the vaccine, but we must mask still. It's very important to mask because this is what has gotten us to this point. When people mask in schools, healthcare providers, when they're in the hospitals, healthcare providers have not been getting COVID from their patients. They've been getting it from their family members at home when they ate dinner together, or coworkers are getting it in the break room when they're eating together or chatting or carpooling together, and they think, oh, this person doesn't have COVID. It's the masks that keep us safe. And so even though and how I think about it. Yes, you may get the vaccine, or we may have the vaccine out there, but we drive our cars, we wear a seatbelt, and we drive the speed limit. It's not either or, not just because you've got a seatbelt on, you still need to follow the rules, right? You still need to follow other safety guidance. You need to drive safely. So vaccines and masking and hand washing and keeping your distance is smart, and we have to keep doing that. If you feel sick with or without the vaccine and you think it might be COVID, you can still get tested. There's a phone line to get tested, and you can go back to that website and you can get tested. All of those things are really important. We can't forget the basics. So yes, vaccine, but even more yes is mask, distance, wash your hands, stay home if you're sick. And a shout out to masking and distancing. Flu season has been almost non-existent because people have been wearing their mask and keeping their distance. And that's a real, people have been doing smart things. And so it's a real testament to what good practices can do. And so also, if you're tech and Facebook and Instagram, another good place to get good information. Let me see if this is going to work for us. Come on, click on it. Oh, it's going to go here. So if you're Facebook, join us on here. This is a little promo here. Join us on Facebook. This is also another great place to get good information on what's going on. They have alerts here. Ask your kids if you don't want to. Tell your children if they're on Facebook all the time to troll it, keep up to date. It gives us information, links about what's going on in the community. We've got like our webinars. You can watch videos of what our supervisors, our health officers, our communications people are doing. We're also on Instagram and we're on Twitter. But I could not figure out how to get those links to work from this, but I could get the Facebook on here. So this is a really great place to get information. It tells us what's open and closed in our county. So stay informed, be ambassadors, get yourselves vaccinated, and wear your mask. That's it.
That's great. Thank you. We do have some questions from our attendees. The first question was, how long is the vaccine effective?
Right, they asked the question that I can't tell you I know exactly. So we think it's going to be probably a vaccine that needs a booster. We think probably a year, 2 years. We're not exactly sure because it has been newer, but we think as we're seeing some of these strains of viruses where you heard it's not the original virus, but there's been a mutation. So we think it's going to be like the flu virus, and we think that it's going to be something that is trying to survive. And so it's going to change a little bit. So we think that we're probably going to need to tweak a little bit the vaccine. So you'll probably need it, if it's not every year, every few years probably is what we're going to do with the COVID vaccine. You can quote me on that, but that might change as we learn more. But I think that's what we can all expect. It's probably not going to be a one and done.
So we have I have a number of questions. So just so you know,
yep.
Be prepared. There are going to be a couple of them coming at you. Do you have any information about the Johnson & Johnson vaccine, which was said to require one dose only?
Yes. So the Johnson & Johnson vaccine, it does indeed require one dose is what we think. We're hopeful that in the next month or so, it's going to be authorized. It's more stable. It's going to come in it's going to be on a cold virus, adenovirus, which is a cold virus. It's going to be the vehicle. It's going to be the trunk it comes in on, and the spike protein is going to be attached to that. And so this is a vaccine tool, right? A carrier to bring in the vaccine that we know a lot more about, and it's more stable. Not a lot more, but the mRNA, we've been studying that for 10 years. So we know a lot about that one too. So yes, it's stable. We hope that it will be more accessible. We think we might prioritize that to people that are not certain they can get in for a second vaccine. And we are hoping the goal would be that might be something that could be in every doctor's office. But again, that's going to be with supply when there's abundant supply. So a safe We believe it needs to go through the FDA and authorization, but we believe and are very hopeful that will be out soon and make vaccines even more accessible.
Yay. And it's refrigerated, not deep freezed,
Exactly right. It doesn't take, super duper deep
You don't need
freeze.
to have the cooler we're going around with that has a thermometer in it and cushions in it and has real-time Bluetooth connectivity so you can make sure it's at the right temperature at all times. And then you have to take it out and thaw it out and do the wheels on the bus with it. It's we're doing mobile vaccine clinics with the Contra Costa Health Services in the residential care facilities for the elderly. So we're seeing this as we do these. It's unbelievable how complex cold chain management is with this Pfizer vaccine. So it's been an eye-opening experience for some of us at Choice in Aging. I'll
add, this one though cannot go in the trunk of the car. It does take some maintenance, so it's not going to be so. But as
it's
an
not
old
the
nurse,
one that's coming in your pocket.
Yeah, exactly.
Okay. So the other day we got a question that if people contracted the virus, should they get that vaccine? And if so, when?
Perfect question. I do need to add that slide. Absolutely, because we think the vaccine gives you a longer, more sustained immunity. And as soon as you don't have the virus anymore, you can get the vaccine. So 10 days after you were diagnosed or your symptoms, go ahead and get the vaccine. The times you don't get the vaccine is if you had one of those biologic treatments. So if you were hospitalized and you need, or not even just hospitalized, this treatment that they gave some famous people that gave them extra antibodies, that one we want you to wait 90 days afterwards, because we think, again, it's like it might not be as potent to the vaccine, so it might not work as well as we want it to. So if you had one of those special treatments for COVID-19, you'll know if you did, then wait 90 days. And they'll ask you when you go to get the vaccine, did you have this? If you say yes, you'll wait 90 days, and that's fine. You're still protected. So don't worry that, oh my gosh, I didn't get my vaccine, because you're still protected from the treatment that you got for COVID. So yes, yes, yes. If you had COVID, yes, we want you to get vaccinated, and you can get vaccinated right away.
And the shingles, if you've just recently had the shingles shot, right? There's a period of time after that you have to wait. I'm trying to remember because we asked this question in the clinics.
Right. So if you've had, so that's a different question. If you had vaccines, we don't want you to get any live virus. We don't want you to get any vaccines within at least 2 weeks of getting the COVID virus. We don't want to confuse ourselves, right, with what's happening, vaccine reaction. So if it's between shingles vaccine and getting COVID, get your COVID vaccine. Don't get your
prioritize life.
Yes, COVID vaccine. Do it.
Okay. So we have a comment. I am more concerned about people younger than 65 with disabilities. Some of our participants cannot be vaccinated because they don't qualify. Is there any option for them?
Not yet. Not yet. So that's a good question. So the caregivers, we want the caregivers to be the ones that get vaccinated. Yes, we agree. And that is a vulnerable population. If they're in some care facilities, they would have been vaccinated. And so those are the things at home. So if you're an at-home caregiver for somebody with disabilities, just be patient, keep wearing your mask, do those core principles, get yourself vaccinated because you can get vaccinated.
Yeah. And speaking of that, if you are vaccinated, you can still transmit the virus to somebody else. Is that correct?
That is correct. I'll give my example. So yes, indeed, because we don't know about if you can be a carrier. So when I was 13, my sister babysat some children who had chicken pox, and none of us were worried about that because she'd already had the chicken pox. Well, a week later, I got the chicken pox, right? So she was able to carry it to me, and even though she didn't get it, she was still a vehicle for it. So we're not exactly sure we don't have enough information about COVID. So we still think that people might carry it even if they don't get it. So again, that's why we're still wearing our mask, right? Seatbelt and drive the speed limit. That's what we're doing.
Thank you. Okay. And Maria, I will add to that not only am I pushing getting people who have conditions that we know lead them to greater risk of death from this virus to priority, because they're in 1C, if I'm not mistaken, in the prioritization. So not only am I advocating for that in the Contra Costa Ethical Allocation Committee, but I am advocating for that at the state level with a group of disability advocates. So I think we're going to do a press conference tomorrow at 11, as a matter of fact, around this. So we are really doing all we can to ensure that those at greatest risk are elevated in priority. So we're working on it, Maria. All right, so we have a whole bunch of them, so I'm going to try not to talk so much and ask you the questions. Are there any programs to help administer the vaccine to homebound clients?
Not yet.
Okay, I'm working on that too, Alex, just so you know. And I did get a response from John Muir on my suggestion to them, so I haven't read it yet, but I saw it came in.
And that is going to depend on the Johnson & Johnson and the more stable vaccine. So right, they all have to come in, right? It comes in with the supply and what supply. And if we get the vaccine that you can kind of carry in your pocket, that's what we're waiting for to do that. So people are working on it. More good humans doing good things. Keep going. Keep going, Debbie.
All right. I've read that natural immunity only lasts 90 days. And I'm assuming by natural immunity, that's a reference to having had COVID. So becoming immune through that. Why would the vaccine provide longer immunity than natural acquired immunity?
We don't know, right? So we just don't know. And we don't really know if it only lasts 90 days, right? So they were doing tests to check the antibodies in people. We think it could last much longer. It's just we don't have proof of that. We have seen infections in people that have had it. We had one young man that had it in July and then got it again in January. So
that's an unlucky person.
Yeah. He didn't wear his mask.
Oh, well, then that was an irresponsible person. I'm sorry.
There you go. Yeah. So
we don't know. It just is.
Yeah. I don't know. I'll try to find that out, but we don't know, but it is. Yeah.
Yeah. Okay. So I heard if you're unsure about future fertility, there's a certain vaccine you should get. Is this true?
So there is no evidence at all that any vaccine, either the mRNA or the Johnson & Johnson, have any effect on fertility. Women on all of the trials there have been women that got pregnant during the trials. It wasn't that they intended to, but they can. So we've not seen no evidence of fertility issues with these vaccines in the trials or any vaccines. So I think there should be no worries, and we really want to encourage people to get vaccinated. There's much more risk of a pregnant woman getting COVID-19 than a woman being vaccinated, but there's no fertility issues in any of the research.
And I would add that my sister, who's a doctor at Contra Costa Regional Medical Center, is still breastfeeding her third child, and she got the vaccine, and she's 100% confident she did the right thing and is promoting everybody else to do it. So I mean,
absolutely.
Physicians, medical professionals, they're not reticent to vaccinate based on fertility, based on being pregnant, based on breastfeeding, any of the above.
Correct.
So is there anyone that should not get a vaccine? This example says pregnant women nursing newborns, children, and I think we just kind of covered that. But is there anybody outside of that should not get the vaccine that you know of?
Should not. So that we're telling people, we want everybody to get the vaccine. People that are getting chemotherapy or might have a suppressed immune system, it might not work as well in them. So we still would want you to get it, but know that it might not be as potent and for you if your immune system, your white blood cell counts are very low. And we ask those questions, you're screened. So you're not accidentally going to get a vaccine if you shouldn't have. So we screen everybody first, but we want everybody to get the vaccine. Period.
Okay. So one of our caregivers asked, how do you, oh, sorry. Didn't mean to cut you off. How do you enter that you are a caregiver of a disabled family member on the vaccine application?
So it's going to ask you, it's going to say caregiver on the submission request. And so you're going to click that button.
Yeah, and I'm trying to remember, and I know that they've changed it since, but there was like healthcare workers or similar settings, which is what the caregivers that we have in adult day healthcare were checking the box on. Dr. Levin told us there were 2 different things that we could possibly check on as paid caregivers, but she said non-paid caregivers, family members are included in that category as well. Are you looking it up?
Well, I was going to try to link to this, see if I could link on here. But it's not letting me. But yes, there's a box for caregiver. So just click the box, and so they might validate in some way, but they're not rigorously validating, right? So there's a trust that goes into this as well. So caregivers, if you've got a caregiver, and they'll talk to you, and you can get it. We do want to do that.
Okay. Sarah is chatting at me that I need to call on the people who have their hands raised, but I can't see hands raised because I'm not the host. So maybe, Sarah, you have to navigate that. You're right. I'm sorry, guys.
Oh, I see one hand raised.
Okay.
So, Liliana, I'm going to allow you to talk quickly if you'd like to ask a question. And you can unmute and ask your question because I see your hand is raised.
Hi, Sarah.
Hello.
That was a mistake.
Oh,
sorry.
No worries.
Okay.
Well, thank you for testing out how we operate raised hands. We now know that if you're not the host, you don't see hands raised. So thank you, Liliana, for the learning lesson.
And I'm going to go back.
I did have a question.
Go ahead.
So I'm going to go back here. So here's our submission form on Contra Costa County. And you can see here, it says home health worker, home care worker, community health, including promotores. So so click there. If you're caring for your family member and you click there, right? So home health worker. I don't think we check to see if you're getting paid. Click on that if you're taking care of a vulnerable person at home, okay? Okay, go ahead, next question.
Thank you very much for finding that and showing that. So there was a question, I think, that Liliana put in the chat around when the MSSP case managers fall under what category for vaccine time frame. So this is important for me to sort of explain that we have 2 different. MSSP is a complex case management program with nurse and social worker team where we go into the homes and we complex care manage folks, right? So medication, caregiving, transportation, all the things that could land them in a skilled nursing facility, we magically fix. Anyway, we have that program in Solano County and Napa County and Contra Costa County. Each of those counties are doing their rollouts differently. This presentation is specific to Contra Costa County, and Dr. Levin was clear with us. If you are a staff person in a job where you go into a frail elder's home, you are eligible. Whether or not that is the case in Solano County and Napa County, I don't know. I can do the research on that and get back to our MSSP based in Fairfield folks so that you know whether or not you would qualify. But Contra Costa folks in MSSP do. So that's the answer to that question. Maureen said, I'm a retired nurse caregiver, but do not think I can volunteer for giving vaccines until I and all my disabled and over 65 sisters are vaccinated because the sisters are living together. And what I will tell you is there's a volunteer page that you can sign up to volunteer with through Contra Costa Health Services, and they would help walk you through, right, Heather?
Correct. If you want to vaccinate, so vaccinators get vaccinated if you're working there, because then you become a frontline, even if you're volunteering. So there's a couple avenues. You can join the Medical Reserve Corps, or you can fill out a form for the county. You must be a county resident to be able to access volunteer positions, in the county.
They are.
So yes.
Yeah. And I would say don't go with the Medical Reserve Corps just because they're under somebody else's leash. I would rather you go to Contra Costa Health Service. This is insider ball game. Sorry, but they're held under certain, standards where, like, if you go just as a general, and I tell Dr. Levin that you exist in the system somewhere, you might get paired with our mobile teams. I don't know, just saying.
And I'll put a plug in for the MRC does as well, except you might get called to respond to the fires as well. But MRC is
Oh,
is,
yeah.
so MRC it's the Medical Reserve Corps. It was built up after 9/11 to make sure that we had all of the like personnel that wanted to mobilize to support those. So people didn't call and say, I'm a doctor or
Yeah.
a nurse. And
It's a
they weren't a
phenomenal
doctor.
program. Yeah, no,
okay.
we actually had one of the MRCs when we were doing our mask fit testing, PPE fit testing at our site. So I had people are concerned the vaccine was rushed. Were steps skipped in the testing of the vaccine when they were testing its efficacy?
Great question. No steps were skipped. No. We were able to use, I say it like, so they use technology.
It's fine. It's the royal, yeah.
The royal, we all did it. So they used technology. So mRNA and the adenovirus, those are technologies, vaccines. So they really just copied off of old technology and science that they had been using and just attached it. So we had this vehicle already, and like, hey, what if we put the COVID spike on there and see if that works? And so they used established technology to get that vehicle. And then they were able to recruit for the clinical trials because everybody wanted to participate. So they were able to recruit a lot of people and go through the trials. And then there was, they were not paid to do this, so there was an incentive to do this quicker. And so they rushed through steps. What did happen with Warp Speed and other things is they said, listen, we will pay for these doses. So even if you fail at this, the money that we gave you, you can keep it. So there was no disincentive even if they failed. And we've heard that some of these companies have not. They found that their trials didn't work. And so then that's just money that was invested by federal governments around the world. That's lost, but it was well worth it. So nothing was rushed. They've gone through absolutely every step. They were able to recruit faster, and they were able to use good technology that was out there already. So
thank you. 2 more questions. Do people with complex medical histories need clearance from their PCPs before receiving a vaccine?
No. So we ask you that there are screening questions that are asked, but we recommend that you get your vaccine through your health home, right? So if you've got complex medical conditions and you go to John Muir Health, try to get your vaccine through John Muir Health or Kaiser or Sutter or the VA. So that's really the best place always to get your vaccine. But we think that everybody a vaccine is so much safer than getting the COVID itself. So we want everybody to get vaccinated.
Okay, yeah, and my other question that I had written down is already been answered by you. So I'm going to ask if there's any last burning questions that anyone has. They can either type it in the, do you foresee that the new mutations might necessitate another vaccine in the future?
So like the flu vaccine, we might do new recipes, right? So they might switch it up a little bit, or like we do every year, there's always a different recipe for the flu vaccine. We think with this mutation, the current vaccine that we have is probably equivalent to what our flu vaccine efficacy is. So about 70–75% effective. That's what the general flu vaccine usually gives you, that protection. And so we think that's what the new virus is. So yes, probably every year they might need to do a little, or every time they do a new COVID vaccine, it'll be the same, maybe a little bit added on to it. So was that too many words? But yes, it will require updating of the vaccine, but not all new, and we will still have immunity from this one. And so get the vaccine. It's going to protect you from all the mutations out there. The degree, it may be a little bit different, but we know the COVID vaccine, people don't die of COVID if they've had the vaccine. That we know. They might get COVID, but you're not going to die from COVID if you've been vaccinated.
Oh, wow.
You've been vaccinated. Yeah, so we do know that. So during the trials, that was it, COVID vaccine. If you've gotten both vaccines right now, we know that mortality, people do not die of COVID-19 if they've had the vaccine. Should I have started with that? And ended
That's a
with
really
that?
great place to start for all the people who are concerned about the vaccine. At least we know that you don't die if you get COVID after you've had the vaccine. I think that it's a really good launching point. I think I'm going to remember that for my future conversations.
You're not going to die. You might get it, but you're not going to die from it.
You're not
And
going to die.
You're most
If you
likely
want to
not.
die from COVID, don't get the vaccine, whatever you do. Yeah.
Right.
So I had a client ask about how to know if they may be allergic to the virus. Is there any recommendations if there are concerns about allergies? I'm assuming she meant allergic to the vaccine. Yes,
Vaccine.
allergic to the vaccine.
So you'll get screened when you do that, and so you'll sit there, and we have epinephrine and Benadryl if you need it, if you have an allergic reaction. So we think generally if you have medication allergies, then you'll just be at a center where they're prepared for anybody that might have allergies. So there's no way of knowing before you get it, but we're prepared if somebody has an allergic reaction. And if you have an EpiPen and carry an EpiPen around with you, take it in when you get your vaccine. Most likely you're not going to need it. Most people with food allergies or other allergies are not allergic to the vaccine.
Okay, so the woman who asked about future fertility, her grandmother that she caregivers for was talking to her when you answered the question. So
Oh.
would you mind just repeating your response to how does it impact fertility, future fertility?
It does not at all. So this vaccine and the technology used with this vaccine and all other vaccines does not affect fertility. You can get the vaccine and you can get pregnant. And definitely if you want to get pregnant in the near future, you want to get the vaccine because you do not want to get COVID while you're pregnant.
Or anytime.
Or small children. Yeah, ever. And you don't want to die.
Or ever. And you don't want to die. So just get the vaccine because then you don't die. I love that. Get the vaccine and you don't die. It's pretty simple. It's pretty simple.
You might die, but not of COVID.
Yes, you may. You're correct. Not of COVID. If you don't want to die the COVID death, which is not a pleasant death. So I want to thank you deeply for coming and for educating all of us. I think we all know that if we get the COVID vaccine, we can't die from COVID. I think we all know that it doesn't matter which vaccine we get. There's not one that's right for us or wrong for us. We should just get a vaccine. I think we know that we should and can help people access getting a vaccine by going to the website, as you told us. We know that we can go on Facebook and follow the Contra Costa Health Services on Facebook and get information and help push that out. And you've asked us to be ambassadors of all of the news and education that we've had today. So we will share. And finally, no matter what, we will continue to keep our distance, wash our hands, and wear our masks. Yes?
Absolutely.
Okay.
Are you coming to every presentation with me?
Every presentation, yeah. I got nothing else going on right now. So thank you for being here. And staff, caregivers, all of the folks who are on, if you have questions that come to your mind after this, please email them to us, whoever your contact is at Choice in Aging, and we will get them to Heather and get you an answer for them. So thank you for joining. Thank you, Heather, for educating us, and may we live a COVID-free life in the very near future.
Yay, thank you.
Okay, take care.
Take care. Bye-bye.
Bye.
Debbie, I'm going to ask you, so we're planning